Good morning, everyone, and welcome to our session today. So our session is the American Rescue Plan Act, or COVID-19 Relief Bill. So going over a few logistics, as you probably noticed, all attendees are muted. So if you have a question, please go ahead and submit that into the chat box. We are going to be recording this presentation, so it should be available later today on Covering Wisconsin's YouTube channel. And then also slides will be emailed to everybody who's attending this live session via the internet. If you're listening over the phone or if you're listening to a recorded version of this session, you can go ahead and submit an email to me and I can send you a copy of the slides. Jenny Appleby, it's jappleby@wisc.edu. With that, we'll do introductions in just a moment, but one of the things we wanted to say is that with the American Rescue Plan Act, as you know, it got signed last week. And so we've been reading tons of articles, attending a lot of meetings, just trying to capture all of this new information and present it to you in a concise, complete format today. So I should note that today is March 19th, 2021. And so everything is relevant as of this date. And with that, Adam, would you like to start the introductions?
Sure. Yeah, I like that preface, Jenny. This is new. This stuff is hot off the presses. And also just to note, we're focusing specifically on the healthcare coverage pieces that are specific to the work that we do at Covering Wisconsin and the work that many of you do throughout the state and some of the things that impact consumers. So anybody who helps consumers in different settings. I am Adam Van Spankeren. I'm the Navigator Program Manager at Covering Wisconsin. I believe many of you know me. We seem to be doing these more frequently, so I look forward to doing it again. Jenny, it looks like I have Navigator Program Manager for you. That's not your job. Jenny, what is your title?
My job is MCAN, Milwaukee Enrollment Network Program Manager.
Right, but she will be stepping into some of this when I'm out on paternity leave, so it's almost fitting.
There you go.
Stephanie?
Yeah, I'm the Insurance Literacy and Communications Manager at Covering Wisconsin.
Great. Stephanie will be, let's see. So we're going to go through an overview of COVID-19, the American Rescue Plan Act, or ARPA. I don't know if I like saying ARPA, but we're going to see how it goes throughout this presentation and where we ultimately land. We'll do some Q&A. We're actually going to go kind of provision by provision through some of the more important pieces related to the marketplace especially. And then we'll look ahead to look at some considerations that people might be thinking about coming April, May, et cetera. And then Stephanie's going to go through the media toolkit and promotions, different things that people might find useful to spread the word and promote the new legislation and the provisions in it and how it's going to really help consumers in Wisconsin. And yeah, I do want to just preface this also with, again, we're focusing on the health insurance marketplace, to some extent the Medicaid stuff, and the different provisions that touch those fields. We're not talking stimulus, we're not talking SNAP benefits or energy benefits. I know that Health Watch Wisconsin published a short video this morning that includes some of that. They did a nice job touching on the broader implications and some of those other topics. So check that out, and there are a lot of other things published. But today we're talking health insurance. So the private health insurance components from the American Rescue Plan Act increase the APTCs, or advanced premium tax credits. So for the marketplace, the savings people get on their premiums across all income levels for this year and next year. They're eliminating marketplace premiums, essentially zeroing those out for households with incomes up to 150% of the poverty level. It is providing APTCs for people above 400%. So that's a really interesting one for, we often see small businesses, working families who just over the limit to get tax credits and help through the marketplace. So this now opens the door for a lot more people. It expands the financial help available through the marketplace for people receiving unemployment. And it's providing free COBRA coverage through September 21. And we'll talk about that in detail. And we're also going to be talking about the tax relief for people when they go to file their taxes. And then, Jenny, do you want to say anything about questions?
Yes, I will. And I think, Adam, there might be, I don't know if your speaker is rustling your shirt a little bit, or sometimes when you move, we hear a little bit of leaf crunching noise. So.
Oh, That's got to be my jacket.
I'll let you know if we hear it again. But
all right.
Yes, so what I wanted to mention is that the way that we're going to kind of format this session is that we've lumped it into different categories. So we're going to talk about current marketplace consumers, then go into unemployment, COBRA, tax filing, some other considerations, and end with Stephanie's outreach and promotional materials. So what'll be helpful is, as Adam is going through each section, if you have a question that's relevant to that section, by all means, enter it into the chat. But if your question is a little different of a topic, maybe just hold on it, because there's a really good chance that we're about to get to it in our next section.
Great. Is this better?
It is. I don't hear anything right now.
Okay, great. I'm just holding it off with my jacket, so that'll be fine. I can hold it and do this at the same time. I can walk and chew bubble gum. All right. So we'll look at the marketplace implementation timeline. And just in general, pretty much everything we're talking about is April 1st. Things start April 1st. There's a couple other things that'll be implemented a little bit later, like the unemployment benefits, but the income-related subsidies to the marketplace are all April 1st. And again, we'll talk a little bit more about that. And then just a reminder that the 2021 special enrollment period, essentially what people have been calling this new open enrollment period that's going on right now, runs through May 15th, though as of yesterday, the 18th of March, I've been looking and seeing things and people talking about rumors that it might be extended, which can be done. It can be done through executive order. So it's definitely on the table, but we won't count those chickens until they hatch. And then new Medicaid state options that are in the American Rescue Plan include lengthening Medicaid coverage for pregnant women. So specifically after they give birth, today there's 60 days, of postpartum after the birth of the child, and they're looking at extending that, I believe, for a year. And then there's also a lot in there, obviously, about COVID vaccine and treatment, and additional funding for different services, including home and community stuff, for states who choose to expand Medicaid, which is still something that remains a point of discussion in Wisconsin, and then additional funding for Indian Health Services. I'd like to note, I'm not going to go in a lot of detail on the Medicaid provisions. We'll talk about Medicaid as it relates to some of the other things, but this stuff, a lot of it is option. So that's optional, and the states can decide if they want to do these things. That said, I'm waiting, kind of letting DHS take their time, look at the whole thing, process it. Again, this is all very new, and tell us what they're planning to do, because we're just not the right messenger for that at this moment. But once that information is out, covering Wisconsin, and Jenny through MCAN will be publishing, I'm sure, all kinds of information, so everybody has the most current info that's out there. So looking at the American Rescue Plan, ARPA, we're going to be talking about current marketplace consumers. Most of the effects that we're looking at today are marketplace, and there's a lot in there. So there's people who will have new opportunities who've never been in the marketplace before, but there's a lot in there for people who are already in the marketplace and will need to look at their plans again. And the thing is, this is the biggest piece of healthcare legislation since the ACA, quite frankly, and there's a lot of components to it. So we're going to give you the best available information we have today, hopefully answer some of your questions, and maybe do a little bit deeper dive if we have time at the end and people have more complex questions, because I've been really up to my eyeballs in this stuff for about a week. So premiums are reduced for all income levels by way of increasing the APTCs, but these are the percentages you'll see under the current law, so just the ACA with its current provisions. I don't like tables of percentages. I don't find them particularly useful because they're hard to conceptualize. But basically these numbers, the percentages, refer to how much of somebody's income they have to spend on the premium through the marketplace. So I was going to run numbers, but it just became an exercise of just doing too much math. And I think it really distracted from the conversation, because the main point here is that people at all income levels are going to be saving on their premiums through the marketplace by the percentages indicated there. And obviously the biggest one is these first three categories. If you're under 150% FPL or under, you're really looking at $0 premiums in most cases. There are, some implications we'll talk about in a bit. And then really just the reduction across the board. People are going to be seeing significant savings The things that we've said about the marketplace will be even more true. Like you'll find a plan for under $50. Now that's like 4 to 5 people. Most people will find a plan for under 10. A lot of people, the lowest income people, will find a plan for $0. It's really big, you know, and the main thing is that people are going to want to look at the marketplace and check out their options. So again, consumers under 150% FPL will now have $0 premium contribution. Again, if they choose different plans, they could choose plans that are above that threshold and have to pay something, but their savings will still be incredibly significant. But with silver plans, most of the plans that they're going to look at, they're going to pay $0. And then all non-smoking consumers under 150%. So again, there's still the surcharge that companies, health insurers can charge for smoking or tobacco usage, I should say. But they have that, they can make that call plan to plan. But otherwise, it's still $0 for the benchmark silver plan with cost sharing reductions. One implication of this that I just want to call out that I didn't see a lot of organizations drawing attention to was basically everything I could find on this says $0 benchmark plan. So the benchmark plan is that the second lowest cost silver plan in accounting. That's what is setting those rates. So that's what's setting the APTCs based on those percentages we just looked at. Now, if somebody wants a silver plan above the benchmark plan, they will probably still have a premium. That's just based on my read of this because they're saying $0 benchmark plan. So that's, again, second lowest cost silver or the one right below it. But they'll probably have to pay the difference for a silver plan that's more expensive, but it'll still be incredibly affordable with the maximum cost sharing reductions, which again is the reduction in deductible, copays, out-of-pocket maximum, and what people actually pay when they use their health insurance. So just looking at this a little bit more closely, limiting the required premium contribution to 8.5% for people with incomes above 400% of the FPL. So we're seeing an expansion in APTCs to people above income limits that were previously not able to get help through the marketplace. So household would not receive a subsidy if the cost of the benchmark plan, what we were just talking about, is less than 8.5% of their income. That's true today, where if in your county the benchmark plan is under that affordability threshold, you're not going to get a tax credit. So it'll still be true for people over 400% of the poverty level, but this still will definitely expand access for a lot of people in different situations in terms of income. We see this all the time as navigators. There are people that make just too much money to really get help and really benefit from all of the savings that the marketplace offers. You know, they don't have a lot of money, and certainly not after they pay their bills, but on paper, they just make a little too much to really get the help they need and, you know, really follow through on the intent of the Affordable Care Act. But this should allow people to find significant savings and access plans that they never would have been able to before. And this is especially impactful for older adults. People live in the state, parts of the state with higher premiums today. Okay, so some of our first questions. Jenny, do you want to go ahead and read the questions so I can take a sip of water?
Yes, and I think that the other thing I'll do, Adam, is questions coming in the chat. And so if it's a question that I think we're about to get to, I'm going to hold on it. But if it's one that's relevant to something you just said, I'll ask now. So before I ask the question, somebody had asked, if there are EHBs, wouldn't they still have some premium cost, albeit pennies, but won't be $0?
So EHBs, most cases, we're talking essential health benefits. Unless that's referring to something else, I don't quite see the correlation. So maybe the person could clarify as we move forward, but essentially all the ACA plans have essential health benefits. They meet the standard for minimum essential coverage. That doesn't necessarily mean that they'll have a premium or cost, even if it's pennies, but you know, they will still see costs in terms of copays and out-of-pocket costs, like deductible, out-of-pocket maximum. But yeah, I'd like to get a little bit more detail on that so I can answer it properly and feel like we were thorough.
Okay. And then regarding those percentages that you had talked about, so any idea if the employer plan affordability percentage will follow that 8.5%?
That's a really good question. That is a very good question. I actually have a question in this later talking about that a little bit. It stands to reason that it would. The percentages, that's very astute. The percentages that was the 9.83, that's changed to the 8.5, they're using the same number. So it's possible and perhaps even likely. And I have a question in here later to talk about that.
Thank you. So the one that you're all looking at, if a consumer is already enrolled in a marketplace plan, will they receive the additional tax credits or those lower premiums automatically?
So yeah, this is kind of the biggest thing. CMS has confirmed this, at least as of last week when they put out a fact sheet and yesterday. So these things aren't going to happen automatically. If a consumer doesn't take any action, they'll see the benefit when they file their taxes next year. So 2022, February through April. But beginning April 1st, that's when these changes are going to go live in the marketplace, healthcare.gov. Consumers should update their healthcare.gov application to reselect the current plan and receive the tax credits for this year. CMS is exploring, they have said they're looking to see if they can internally update the site and the system to make those apply across the board. And technologically speaking, that's a really heavy lift. I would be surprised if they can pull that off. I'm actually going to be pleasantly surprised if all of this works day one, April 1st, because it is such a system-wide change and update. So short answer is no, they will not do it automatically, but there are things, I have questions about things like the correspondence communications that will go out to consumers that we haven't really heard much about yet, but they should always take action and look, just like the usual when we look at provisions like this. Jenny, anything else specific to this? The next one is kind of on this topic as well.
Yeah, we'll just continue with this. If a consumer is already enrolled in a marketplace plan, should they return to the marketplace to review new plans?
The answer to this is yes. I might upgrade that to absolutely, actually, just because this is huge. So people who we help, very low income, who've been struggling, who might need the benefits right now, most of all, should be going into the marketplace. We should be helping them. If we have the ability to follow up with people we've helped before, we should do that. Stephanie will talk about promotions and marketing, and I think reinforce just why this is so important that people find out about this. Again, I don't know much about the CMS correspondence plan for letting people know that they have these new options and savings. I assume there will be something, but it's always hit or miss with correspondence to consumers if they're going to take action or not. But yes, all enrollees should log into their account, contact their navigator, their CAC, their agent, and update their application to review the plan options before May 15th. I say May 15th because of the end of the current special enrollment period. And we'll talk about that in a little bit. I said that it might be extended, but I have another question I believe that's been asked about whether or not people can still benefit from these after May 15th, but we'll talk about that. So yeah, they're going to find plans with lower premiums, lower out-of-pocket costs than what they're currently paying. And it's going to be super beneficial. I mean, there may be people who won't want that, who may just be happy with where they're at and want the savings back on their taxes, but everybody should look.
And then the question came in of if we have someone that wants to apply over the next couple of weeks, should we encourage them to wait until after April 1st?
Well, if that person needs coverage for a service in April, I would say get them in right away, talk to them, let them know that there will be changes, but make sure that they get that coverage they need for the month of April. Again, with the current special enrollment period, anybody who applies right up to the end of the month will get coverage starting April 1st. So that's the thing. If they need coverage right away, absolutely get them in, do an appointment, get them enrolled now, but be sure to have a second appointment with them after April 1st. If for whatever reason they have coverage right now and you're looking to work with them for May 1st or later, their coverage ends April 30th, then it doesn't matter quite as much. You're going to want to talk to them in April, but if they don't have coverage right now or they're about to lose it at the end of March, absolutely do the appointment, get them enrolled now and revisit it in May or April for May.
So do you recommend that we reach out to our current clients to ensure they get the lower premium?
If at all possible, yeah, if at all possible, absolutely. They're going to want to know about the options. They're going to want to find out if they can get savings. They'll also be hearing a lot, and certainly, as we know, I didn't include anything in this training about this, but when there's new things like this, there's also the opportunity for scams and predatory calling and things like that. So it's better that consumers you've worked with hear about it from you, from a trusted source, and you can help them enroll again, or report a life change, I should say, and get the most savings.
And then when we talk about going back into someone's application, what information should be changed if there's no new updates? Can you just type the address over correctly, of course, or what would they do in the application?
Yeah, that's a great question. I like that it's so practical and hands-on. So yeah, if the button in the application says report a life change, you're not necessarily reporting a life change. You're just resubmitting the application. So that button, report a life change, is going to open up the whole application for you, and you'll go through all the questions. And you can just work with the consumer and confirm that everything is the same. Maybe there have been little fluctuations in income, or maybe they have an actual change to report. But if you just go through the whole thing and submit it, especially right now, they'll get the special enrollment period. They'll see that again. But they should see the new prices and everything just take effect. So at that point, you're going to be going through the application fairly quickly and then looking at the new plans prices available to them.
Thank you. So the question on the screen, when will these new plan changes take effect?
Right, so we talked about the marketplace updating April 1st and that being a heavy lift. I haven't seen anything about this specifically, but it stands to reason that it would be May 1st. There's no reason to think that if somebody signed up, looked at the plan, reviewed their options April 1st or 2nd, that they would see a benefit in April. That's just not how the marketplace works. So we should, unless we hear something else, expect to see people seeing the changes, seeing the premium adjustments, seeing the changed cost sharing reductions as of May 1st. I think Jenny's reviewing the chat.
Yes, there's been a few questions about this in the chat. And I should note too that when we pulled together this information, our team, we at the end have a source of references. And so if you did want to dive in deeper or say, okay, where did you get that from? There is a reference list at the very end of this slide deck. So this question on the screen has come up a couple times in the chat. Will the out-of-pocket costs a consumer has already paid for 2021 carry over towards the deductible or the out-of-pocket max of a new plan?
This is very similar to a question we covered in February with the new special enrollment period. So the answer is the same as it was then. So it depends, right? So a consumer switching health plans, if they switch companies, definitely they should be expecting to pay a new deductible, new out-of-pocket maximum. If the consumer stays with the same insurer, same health plan, and just switches a plan from silver to bronze with that same company, they should talk to that company. They should call, see if their payments towards the out-of-pocket costs will carry over to the new deductible, to the new out-of-pocket maximum. The most important thing is that people talk to and work with their insurers. Some will, just like the last training, we knew of some right away that were going to be carrying over payments, but some may not. It's actually, they have the prerogative. They can choose to do that or not. So it's definitely worth the consumer investigating, calling, finding out. But it depends. Now, if a consumer switches from, or stays, let's say they stay with the same plan, and the cost sharing reductions are reduced. So the deductible and out-of-pocket maximum are reduced. All of their previous payments towards those should count. If that is not the case, they should be appealing that within the health plan itself. But if they stay with the exact same plan and those amounts just go down, those should not be reset. And then one other implication on this that I saw is a really interesting question when I was researching this was if people bought a plan, an equivalent plan off the marketplace. So there's, on the marketplace versus off the marketplace maybe being a little bit cheaper, but not getting the tax credits. The question I saw is the people who may have done that, who might be over 400% of the poverty level, if they join the marketplace as a result of being able to get tax credits, will those deductibles and out-of-pocket costs transfer over to a marketplace plan, the equivalent marketplace plan? So they'll be staying essentially with the exact same coverage with the same company. That remains to be seen. So a consumer doing that, these higher income levels, should definitely be talking to their insurer as well. So the answer is work with the health plan. Company to company, no. Plan to plan within the same company, it depends.
Yeah, and I think there was something that came up in the chat, and I think that a couple of us at Covering Wisconsin has been connecting with all of the qualified health plans, the QHPs around the state, and that many, yes, if you're staying within that same company, that deductible amount will carry over. So thank you.
Absolutely.
A couple of the things that came up, given, maybe we'll wait on this one, but what about ROL made between 16th through 30th of a month? Would that now be a June 1 effective date?
I'm blanking on what ROL should stand for. Somebody should just throw that into the chat. I think I understand the question regardless.
Yeah, I think it might mean the rate online. But if somebody's the 16th through 30th date of a month, would the effective date be the June 1st date? So
still we're in that special enrollment period now. So if you're looking at the 15th through the 31st of May, that could be July. But right now in the special enrollment period, so February through May, the plan changes should be effective April 1st. So if somebody changes a plan, March 30th, they should see all the changes April 1st. The most significant one timeline-wise would obviously be April 28th, 29th, 30th. They should see those take effect right away, May 1st. After the special enrollment period and these new rules that are in effect right now end, then it would be kind of back to the way it was. If you're in the second half of the month, it would be the following month, not the month right after, but the one after that. That could change. Again, with the executive order or extending the current special enrollment period rules, that could change. But rules as written, it would go back to the way it was before. So the month following the next month.
Okay, so the asker had clarified that ROL, the rep of life change. If I make a change from 16th through 30th, typically changes made during this time are first of the next month. Will this still apply?
Oh, in that case, I see no reason why they wouldn't. If you make a change, stay with the same plan. I don't see any reason that wouldn't be the case. Unless, I am crossing my fingers and toes that there won't be any technical issues. They handled the new special enrollment period really well. So there's a lot in there. CMS is planning to do some webinars and trainings on this before the end of the month. We just found that out yesterday. So that will be really great for hopefully some clarifying questions like that. But yeah, so anything, it could change, but I wouldn't expect that to. It should work the way it does now if somebody stays with the same plan.
Thanks. I'm going to hold on a couple of the other questions for a moment.
Okay, cool. Well, we're going to touch on the unemployment as it relates to the marketplace. So, and I got to move my little rogues gallery in the corner here. So this is pretty big. Anyone receiving unemployment in 2021, so this year at any point, will have their income capped at 133% of the poverty level for determining marketplace financial help. So talking premium tax credits, you're also talking, as you'll see in the next bullet, the benchmark silver plan, cost sharing reductions. So at that income level, you get the maximum cost sharing reductions, which means your $3,000 deductibles in the silver range could go down to $500 or $300. Same thing with the out-of-pocket maximums, and the copays will be significantly reduced. So this will be really helpful for anybody who had to take unemployment at any point this year, which is a lot of people that we see and a lot of people that we help as this pandemic continues. So that's pretty big. We'll talk about how the unemployment may relate to people on COBRA, because often those two things will go together, and there's a lot going on with COBRA in this as well. But the other thing is that we don't have an exact date that this will go into effect. It might be a more technical lift. There's other things around unemployment that in the COVID relief bill or ARPA that may also have to go into effect at the same time. So what we've heard is this won't be implemented until summer, beginning or end of summer. I don't have much more information on the timeline than that. So yeah, the note there is, we talked about this, mentioned it before, but the tobacco surcharge could still apply. So if you have somebody who is a smoker or a tobacco user, they can still be charged the tobacco surcharge on top of the savings in terms of the premium.
So a couple of questions about this. So even if you get a job with no benefits where your income is much higher, you are still 133%?
That's what it says. That's what our understanding is. So if you start making a lot more money because you were on unemployment at some point during 2021 for the marketplace, if again, nice clarification, the no benefits, if you go or stay with the marketplace, your income should be capped and you should still be seeing that financial help. And I believe that's the intent. Haven't seen anything that contradicts that. So it's a good clarifying question, but that's the only thing I've seen on this.
Okay. And so somebody asked in a longer question, but is the unemployment additional subsidy applicable regardless of other household income? If the household qualifies for a subsidy at 300% of FPL, but one received unemployment, they still qualify at 133%?
Yeah, that is a great question. I hadn't looked at it to that degree, thinking about household with everybody in the marketplace. The short answer is probably, especially if the person receiving unemployment is the application filer, the main person on that application. Now, it could be calculated as such that it would take into account for that person, and you get a really weird premium situation for the family. My guess would be that they would take into account just that one person. And this answer may already be out there. I just didn't see it. So I would suspect it would be for the whole household, especially, if it's one of the tax filers and not the tax dependents, that it would apply to the whole household. But it might be different than that. And we can take that back and try to clarify, or CMS will soon.
Yeah, because that was this other question, is a similar way of phrasing that, of if it's a family plan, only one person has to be unemployed to receive this APTC. So that kind of question, I think.
Yeah, for sure. We'll ask CMS. I didn't encounter that specifically. Intent-wise, I think if it's one of the tax filers, then yes, but it's technically possible for it to do some weird stuff with the premiums in the actual plan for the whole family.
And then does this cap include withdrawals of retirement to pay off their home to prevent foreclosure?
Oh, interesting. In terms of the way it's written and the way what we've seen, when you withdraw early from retirement for the marketplace, that gets counted as income. I don't see why it wouldn't. There's nothing that I've seen that says that would be an exception or an exemption to this rule because it counts as income. So I think they would still be fine on that, especially the retirement. If you take out retirement early, yes, it counts as income. You have a little bit more control over when that lands in terms of when you're counting it. So I don't see why they wouldn't be capped even if they did that, because it's income.
Thank you.
Mm-hmm.
So the next question on the screen: should consumers in Wisconsin receiving unemployment benefits but with household income below 100% FPL apply for BadgerCare or marketplace coverage?
So I got different versions of this question, and I just kind of wanted to reframe it to make it less confusing. So if people are 100% FPL or lower, they should be on BadgerCare. That's the rules. That's the way the system is designed to work. So if you're under 300% of the FPL for children, pregnant women, adults under 100% of the FPL, they should still be on BadgerCare. Currently, with the pandemic, Wisconsin is not removing people for exceeding the income limits later during the public health emergency, so they should stay on BadgerCare. People who have not already enrolled in BadgerCare with income over 100% of the poverty level should go to the marketplace. and take advantage of those savings. Now, there is a category between these two where somebody could be a gap case, right? So if they could be a gap case for BadgerCare, but their current monthly income is too high, and they could go to the marketplace, then they have the option. But it's probably at that point a little complicated, and they'd be looking to work with an enrollment assister, navigator, CAC, or agent to really figure that out.
So one question related to that, given the changes, are there any conditions where individuals currently enrolled in Medicaid consider enrolling in a marketplace plan? So what I'm hearing is that, for one, if they're under 100% FPL, they don't have that option, right? Because they're enrolled in Medicaid precludes them from enrolling in the marketplace. But what about people who are currently on Medicaid due to continuous eligibility, haven't gotten kicked off and have a higher income now?
Yeah, so I was hoping not to have to go into a ton of detail on this, because there's some really interesting kind of wonky situations that can happen. Kind of what we were talking about, I think at the last training, where it's people may have both right now because of, different, not being aware that they were still on Medicaid, or not being aware that their marketplace coverage hadn't ended. And there are some really interesting situations that come up because people aren't required, and I believe we'll talk about this later, aren't required to pay back tax credits that they shouldn't have gotten if the amount was wrong. But for the purposes of making this cut and dry, I would say, this answer is the answer you want to go with. People can get off of BadgerCare if they request it. I believe that request has to go from the county to the state. It's certainly possible. So they may want to look at marketplace coverage, and there are certain reasons to do that. If you're looking for a particular service that a provider basically if they're not taking BadgerCare for that service, or if they're not giving priority to that kind of service, or if it's not medically necessary, then private health insurance might be the way to go. So there are reasons to do that. And there are a lot of complicated situations that could come up. But at that point, I would say really case-by-case basis, you should be working with a navigator or a CAC or another expert to figure that out. There's no broad answer that I would feel confident applying to everybody who might be in that situation.
Thank you. Also, another question was, will there be a question in the application asking if they received unemployment at any time in 2021?
That's a good question. That's a good question for CMS. I would like that to be the case. So when they make those changes in the summer, that would be nice to have. It's not technically necessary because of the records that the state and the federal government keep. They can, when you put in information, they could technically flag unemployment through the different data sources that they use, but it's not, I would much prefer to be a question. So if there's any mistake, the consumer has the ability to overwrite that. But the simpler answer is, you enter unemployment income, then it says, okay, you received unemployment in 2021. So I think that's probably the way that they'll go, is just looking at the income that's been reported.
Yeah, and that's what somebody else is saying, that you should be entering unemployment, so it should tell them. So you're entering that as an income, that would alert them, yes, there's been unemployment received.
Yeah, I kind of get where the question is coming from, or why that they would want that. Because if most of that income, for the entire house could be disregarded down to 133%, it may, people may be tempted to just kind of report it differently or think about it differently, but you should still be plugging in all the income you have, and the system should be updated to cap that at 133%. So.
Thank you.
Mm-hmm.
Should consumers who are receiving unemployment benefits wait to apply for or update their market account until changes are implemented?
Right. No, CMS is advising people, if you're on unemployment, to go ahead and apply, update, or change your plan, even if those haven't gone into effect. Once the unemployment benefits or updates are available later in the summer, they should come back and update their application again. Otherwise, they see the money back on their taxes. I was going to do kind of a tangent on unemployment, but it's not quite in this lane, so I'm gonna leave that alone. Any other questions on the unemployment stuff? This might be our last question in this section.
Yeah, I think it's our last in this section. What I'd like to do is maybe we'll quickly, or we'll go through the COBRA, and I'll ask a few more questions before we move on to Stephanie's portion.
Great. All right, COBRA, this is a lot of interesting stuff. Let's go ahead and get started. I'm gonna move this. So what's in the American Rescue Plan Act, they're subsidizing an entire COBRA premium from April 1st to September 21st for laid off workers. Basically, they're giving a tax credit to employers, and so allowing them to work with the health plan that they're using for that company to change the COBRA premium to $0. We'll talk about some of the deeper implications of that in just a second, but it's pretty big. I mean, it certainly sounds big that people, if you're laid off, in May, that you're going to be able to stick with your same plan, the one you've been paying deductibles and things like that towards, possibly very good coverage depending on your organization, and keep that plan and have them pay the premiums through September 21st. So that is a very big deal for people, especially people managing conditions or whose provider networks might not be available through the marketplace BadgerCare. Now, it extends the enrollment window to allow an employee still within their eligibility period to enroll. Again, this is another thing we'll talk about implications of in just a second. So basically, usually somebody has 18 months to enroll, 18 months of COBRA coverage, but they have 60 to 90 days to enroll in that COBRA coverage. This means that somebody could, assuming they didn't, voluntarily quit their job or end COBRA coverage, that they should be able to 5 months later get on that COBRA coverage. So that is a difference, and we'll talk more about that in a second. Employers are required to notify their employees within 60 days of April 1st of this. And again, people who voluntarily leave work are eligible for Medicare are not eligible for this rule, the subsidy to pay the COBRA payments. So there are some key points that I went down a rabbit hole looking at this stuff, so I may take the wind out of some people's sails, but I really wanted people to be aware of this. So while the enrollment window is extended, so people can jump back onto COBRA that they've been eligible for, the end date for that COBRA has not. So COBRA typically lasts for 18 months after they're first eligible. An employee who's eligible, say, first in February 2020, they can get it subsidized from April to, I know it's subsidized between April and September, but 18 months is actually August. So they would suddenly be off of COBRA at that time and need to get a special enrollment period and hop on the marketplace or other coverage depending on their situation. And we'll talk quite a bit, I'm sure, about people getting a special enrollment period when COBRA ends. Now, the second point here, this is my read specifically. If there's something out there that contradicts this, I'd be overjoyed, frankly. And if somebody put it in the chat, I'd be really happy about that. But everything I read in terms of preparing for this training said that the COBRA subsidies are for April 1st to September. So there's nothing that says premiums before April 1st would be subsidized. And typically the way COBRA works, somebody who goes back to get COBRA coverage would have to pay the premiums that they had previously missed up to the current date. So they may still be in a situation where they have to pay a lot out of pocket. This is great for people who are offered COBRA between April and September, but that may be a situation where people can't really benefit because those COBRA premiums, that full cost for insurance, could be really expensive. Now, again, I hope I'm wrong about this. I just hadn't seen a lot of people addressing this specific, the before April 1st question. And then, so just thinking about this a little bit more broadly, tying it back to something we already talked about, consumers who receive unemployment benefits in 2021 have their income for marketplace premiums capped at 133% FPL. So essentially guaranteeing $0 coverage with substantial cost sharing reductions, out-of-pocket costs through the marketplace. So that may give them better options through the marketplace. It's certainly worth looking at. As is always the case when you're offered COBRA, you always want to look at the marketplace. You always want to look at the whole situation of what somebody's being offered.
Okay, so some activity regarding COBRA. So
sure.
So first, it was stated that on COBRA, people won't need to pay back premiums. That was more of just a statement clarifier for that. Good. And then the next question, will an employee that is on the marketplace have to wait to receive the COBRA offer to sign up for it?
One player. Is that saying the notice from the employer? So, okay. That's a good question. I would say yes, only because I would assume that the infrastructure might not be there to do that. But in practice, they might be able to reach out, just being aware of the rules and say, hey, I want to get on COBRA now. I mean, I certainly think intent-wise they should, because yeah, there's a big difference at 60 days between when it goes into effect and when they're supposed to be notified. So I think they should be able to, but I don't have a guaranteed answer on that.
Okay. What about people that voluntarily left work, but it was because of health issues? Will that qualify for the COBRA subsidies?
Now we're getting into like, it depends, like a lot of it depends. That's a really specific question. It depends on the nature of that employee's relationship with their employer, whether, that health situation, how it affected their work, how those things were worked out. So I'm not going to give a super clear answer on that. It depends. If they voluntarily left work, more than likely they won't be able to, but there are certain situations where somebody could possibly get the COBRA, where I've seen, somebody voluntarily leaves their job, but the employer still offers them COBRA. So it's possible, but generally speaking, that's a really case by case, and I don't want to give an answer on that.
Okay. Once the COBRA subsidies end later this year, does that create an SEP to get into the marketplace?
Yeah, we'll be talking about that in just a second. So we'll get to that.
Okay. And then someone said, I read an article this morning, and then she had sent a link to the article that said this applies to small employer state continuation benefits as well. Do you believe that to be accurate?
That's another good question. I did see about the state continuation coverage. And I'm just trying to remember what I saw. It may be accurate. I will just come out and say I don't know on that particular thing. I did see something like that, but I don't feel confident about answering it. It's definitely possible.
Okay. Would people who elect to retire in 2021 be eligible for free COBRA?
Elect to retire in 2021. That's a good question. It kind of depends on the employer. If they're offered COBRA, they'd be eligible for free COBRA. But again, a lot of these and a lot of honestly COBRA situations that navigators see, it's really case by case, and we see a lot of different kind of one-off situations. So it's possible. Not a lot of these questions that are coming up have nice blanket answers, which I think is why there are so many questions, which is unfortunate. But yeah, just make sure they're working with an expert to get the answer, and work with that employer. We're going to be working with a lot of HR departments, I suspect, and experts to figure out what the implications will be for each individual.
Okay. Thank you.
Okay, well, people, oh gosh, sorry, Jenny, I'm talking.
No, that's okay.
Yeah.
So will people who choose to enroll in free COBRA be eligible for a marketplace special enrollment period after the subsidy ends?
Okay. Yeah, that's why I was like, I wanted to cover this because we were just asked it. Now, this is my answer. So I just want to put that out there. This is my answer based on my experience. This is not something that I read in a published, thing, but this is a question we were getting a lot. So I'm giving the answer as I see it in practice. So when the subsidy ends and somebody's cost goes back to 100%, it goes from zero, they had to pay $0 up to the full price of insurance, they should get a special enrollment period. In practice, I've done it a number of times where basically you take the letter that they got that says, hey, your COBRA is the subsidy, or what we're paying, our contribution is ending, and you're going to have to pay full price. I basically used that letter and turned it around as a loss of coverage letter and gotten people special enrollment period. It's never not worked. So people may have had different experiences, but I absolutely believe they will get a SEP without an issue.
All right, so some of the other questions I'm going to ask are getting a little more off topic. So I will the COBRA part. I can't remember what comes next.
Oh, okay. Next we have tax filing. It's pretty brief, I think.
Okay, why don't you briefly go through that? I'll quick ask the questions and then we'll get to Stephanie.
Perfect. I have no idea what time it is, by the way. All right. when filing taxes this year, so for 2020, consumers will not be required to repay any excess APTCs. So they'll still get money back if the APTC that they received was too low, but this gives them a little insulation on some of the more complicated tax situations that people have been having where they've been required to pay a lot back because of the different fluctuations and especially the unemployment income. That's been the big thing that's been slamming people who filed taxes that where, the marketplace was counting this unexpected boost in unemployment income, or they should have counted it and most consumers didn't report that change is what I should say. The consumer didn't report the change to the marketplace. So when they go to file their taxes, their income is looking a lot higher than what it was on their application. So they're not going to be required to pay back these excess APTCs, which is really good news. Also in practice, the first $10,200 of unemployment can be deducted if the household's income is below $150,000. Could mean money back. Again, like this is the same situation. If a consumer would have received higher tax credits, they could get more back on their tax return, which is nice. And then we go right into questions on this. Go ahead.
So what if a consumer already filed their taxes for 2020? Can they get money back?
Short answer is yes, but the longer answer in terms of what I looked at and put together for this training, the IRS needs to determine how to retroactively apply these changes for people who've already filed their taxes. They put out a statement on March 12th. It's still on their website as of yesterday that they're looking at these provisions and urging taxpayers not to file amended returns until the IRS has issued more guidance on this. So in theory, or almost certainly, yes, they'll still be able to get those benefits. I mean, legally, I absolutely think they can, but not to refile or file an amended return until there's more clarity on this. Okay, anything on the tax stuff, Jenny? Because otherwise there's just, I think, one or two more other consideration type questions.
Yeah, why don't you go through those other considerations?
Sure thing.
Actually, there is a tax question.
Okay, cool.
You already had taxes deducted when receiving your unemployment benefits in 2020.
You say that again, the first part cut out for me.
What if you already had taxes deducted when receiving your unemployment benefits in 2020?
That's an interesting one. I am not an expert in unemployment, so I won't really give an answer for that. It's definitely a good question. Most people in Wisconsin, anyway, as I understand it, have the taxes taken out when they receive their unemployment. I don't know how that comes out in the wash when they're filing taxes. So I would refer that to somebody who really knows their stuff on unemployment and taxes as opposed to the health coverage.
Thank you. And we are at 5 minutes time, so I want to respect the people who just jump off at 10. So for this one, just very quickly, will the American Rescue Plan Act help consumers who failed to sign up for affordable employer-sponsored coverage?
Okay, this is really deep in the weeds, so I'm just going to summarize this pretty quickly. This refers to the question that people asked earlier about whether the affordability test will change for employer-sponsored coverage, because those do use the same numbers. So that 9.83% is the same 9.83% that was the affordability test to determine if somebody was offered affordable coverage. So it's possible that a lot of these large employers like to keep their plan to about 9 and 9.5% of somebody's monthly income, so they can't get APTCs. But if that suddenly lowers as of April 1st, it's possible that people who didn't sign up because they thought it was too expensive can go and get APTs through the marketplace. We don't have a key answer on this, but we may see one later. But the big thing is how are people going to find out? That's the trick. And then looking ahead, healthcare.gov will be updated April 1st. So assuming everything goes well, the May 15th deadline could be extended. Assuming it's not, consumers should act by then for most options. And I think I meant to mention this on a slide. So people had asked also if they don't act at the special enrollment period, can they still see the benefits? The answer to that is yes. Anybody who reports a change between now and April and September, 30th should see the changes, the benefits to the plans that they're currently on regardless. But if they want the most options to switch plans, they should do everything before May 15th. So yep, that's what I just said there. And then unemployment takes effect in summer, and then the COBRA subsidies end the 30th of 2021. Some people could run out of COBRA itself before that.
Okay, and as a clarifier, the employer coverage affordability percent won't change. It's still 9.5%. It would require an additional law change to make that happen.
Perfect. Yeah, I'm glad somebody had that because I was looking for it and I could not find it. Great. Thank you.
Thank you, Tara Straw, who is an expert.
Oh, great. Tara Straw's on. Okay, good.
Great.
Fantastic.
The one question that I wanted to get back to, and then we're going to speak. Those of you who asked questions, if we didn't get to them yet, we will hang on after 10 o'clock, but I know some people have to jump off. The one question that going way back to when we talked about that $0 cost, that regarding the rules for applying for the advanced premium tax credits to the premiums, that essential health benefit question that came in. So the clarifier for that was that the APTCs only cover the portion of the premium that is for essential health benefits. So if a carrier has a plan that's not 100% essential health benefits, they may still have some cost associated with it, correct? So the question, APTCs, advanced premium tax credits, cover the parts of the plan that are essential health benefits. So if you have a plan that has other things not essential health benefits, you wouldn't get the $0 premium because you'd still have the cost associated with those other things. Does that make sense now?
Yeah, kind of. So for marketplace plans, we don't typically see that. That's kind of a more complex plan situation that I haven't encountered much of at all. I would just say it stands to reason that there could be a difference there. It depends on how that plan's premiums are kind of bundled up to the provisions. But I don't think that would come up very often. I wouldn't expect to see that, honestly.
Okay, thank you. Stephanie, thank you for with us. And wow, everything looks beautiful. So take it away.
Okay, I will be brief because I know there are some additional questions. We all need to work together to spread the word, right? I mean, this is an amazing opportunity. This is a game changer for a lot of people in our state. So we really, really need to get out the word. Covering Wisconsin has already 3 new messages. If you go to our toolkit, we do specify effective April 1st, so you know when those changes take place. So if you start sharing stuff before that date, whatever you share, I would make sure you include that date on the materials, or if you do a Facebook or Twitter post, something like that. And we will have additional messages coming soon, especially related to encouraging consumers to update their account. We were just waiting to see what CMS would say with that additional guidance about how they were going to handle that. But we have messages ready to go. We're just waiting to get that final word from CMS. So we want to get out the word to our own consumers, to future consumers who have never qualified before. We have flyers, social media posts, outreach cards on our website. Outreach cards can be personalized on the back side. And then there's also, if you go to the next slide, Jenny, OCI also has a toolkit. They will be updating theirs in the very near future. I just didn't get the date when that would be live to reflect some of these new opportunities and changes. And then of course, there's always, go to the next slide, there's always the national places such as healthcare.gov has materials. I haven't seen yet that they've updated their toolkit with anything related to the expanded tax credits or new opportunities. And then MCAN, if you follow these groups on your Facebook pages, it's much easier to see the new posts and you can just share them. And it also helps create a more viral situation for people and spread the word better. It helps with those algorithms. So I'll also say that Covering Wisconsin is looking to do a lot more promotions in the next, what do we have, 7-8 weeks. You'll especially see that coming out the last 6 weeks of the special enrollment period. So we're going to do our best, but it's a big black hole, and most people will do something if they hear it from a trusted source. So your best the best way to spread the word is to spread the word with your consumers, to spread the word with your family members, spread the word in your community. And I think if we all work together, we can really make sure a lot more people are aware. So I'll give it back to you and Adam, Jenny.
I'd just like to say, I know Stephanie's section got crunched there at the end. In terms of practicality and helping people, honestly, spreading the word is probably the most important thing that needs to happen. All this other stuff on the rules, we can look it up when we need to, but people need to know this is going on, that they have these benefits. We're talking about, across the country, millions of people who are going to benefit from this, and they need to know about it. Obviously, there's going to be a lot of people doing communications, but everybody should be doing their part.
I will say one other thing. We've done some really brief market research, especially with groups who tend to be suspicious of government and whatnot. And we found that when you're messaging, if you refer to it as COVID relief, it tended to play well with that particular audience. So we are using that language in our materials. So new COVID relief.
Great, that tracks.
Mm-hmm.
Thank you. In the chat, look at the very bottom, the last link I put, that's an evaluation. So we appreciate it if you can fill out that evaluation, not the first link, sorry, I think that was still a preview, but the last one in there, if you can fill out that eval. Some of the questions, Adam, that I'm just gonna kind of go back to because they were earlier in the presentation.
Sure.
So, and for those of you who have to log off, thank you for being here today. We'll get to the previous questions right now. If you are in a bronze plan, can you switch to a silver plan to be able to get cost sharing reduction?
Yes, at least for the duration of this current special enrollment period, that's how the rules were affected by that. I don't know if it will be continued after May 15th, so I would urge people to act now to do that because we know that's the rule. It's entirely possible it could be extended or that rule in particular could be extended. But I haven't seen that specifically. So basically I'm telling everybody to do everything by May 15th, just in case, especially if you're trying to switch plans or metal levels.
Regarding the slides, so whatever you're logged in as right now, so however you joined, that's where you'll get sent the copy of the slides. So I'll do that once the recording is posted online. We'll send a link to the recording, we'll send the slides, and we'll send a link to the evaluation in case you missed it. All right, another question. What are the implications for employers and penalties under the ACA?
That's a great question. It's one that I did not look at in preparing for this. I'm thinking, mostly about consumers. With the answer that Tara Straw gave, that particular thing that I was talking about would have been the main impetus for changing, whether employers would suddenly see penalties. But more thorough than that, I don't know the answer. And we could take it back, but it's definitely not something I have right now.
Yeah, and the quick answer is employer penalties won't change.
Perfect. That's what I thought, but yeah.
Okay. So going back to, there was a question, and I think this was one of your very first slides. I believe it's probably related to the Medicaid question. Will this extension apply to undocumented pregnant women?
Oh, That's a good question. In terms of, Medicaid, so undocumented pregnant women, we're talking about a couple of different programs, specifically the BadgerCare for I'm blanking on the name of that BadgerCare program. I haven't done that in forever. Basically, the BadgerCare program. Thank you so much. Prenatal is for undocumented women. In terms of that extension, I don't have an answer. The state will have to, publish their intentions about each population or each program, whichever the things that are offered under the COVID relief, the ARPA, they'll have to respond to those and roll out their own communications about what's going to happen. So just wait for the state to let us know.
Okay, one more. I have a patient that enrolled effective 1/1/21. She is struggling to pay her monthly premiums. My understanding is that you can request a backdate of coverage up to 3 months. When she updates her plan after 4/1/21, will the new plan premium be retroactive to the new start date, including the back date? So the first question is about backdating coverage, though.
Right. Yeah, that's kind of what I flagged too. So backdating coverage specifically relates to BadgerCare, especially the 3 months. That's a BadgerCare rule. BadgerCare backdates to the first of the month and up to 3 months before that if you request it and you were eligible during that time. In terms of marketplace coverage, backdating isn't really a thing unless you're talking about errors and appeals and things like that, in which case it can happen. But well, what's the second half of that question, Jenny?
The second half of will the new plan premium be retroactive to the new start date, including the back date?
Right. So talk about two different things. Yeah, the premium extra savings we've been talking about, that's marketplace, and BadgerCare is the one with the backdating. If there was any sort of situation where marketplace coverage would be backdated, again, most likely because of an error or a technical issue, it would go to April 1st. Or sorry, it would go to May 1st, technically, because it's implemented April 1st, but they should start in May 1st. I guess that's technically possible. It could go to April 1st, but I don't see why it would. Okay.
And then the question, so logistically speaking, if an employer's plan costs less than 9.5% of income, it will still disqualify someone from eligibility, even though they could get down to 8.5% on the marketplace.
Yes, I mean, just based on that answer we got and how the affordability test works, yes. Are there things I might do if I saw that situation? Probably. I would say, as that comes up, talk to Covering Wisconsin, talk to our navigators, and we'll look at it on a case-by-case basis, because that's obviously something that concerns us greatly right now that we already have to contend with, and just doubly so considering just how great the advantages will be through the marketplace for this time.
Okay. Thank you. I'm going to stop the recording now, but you can all hang on for just a moment. So thank you to those of you who are listening to the archive version.
Yep, thanks.